Morning, and we're just going to use first names only and no personal identifiers in case there's some Russian hacker who's listening in. Don't give me your credit card number or social security number or expiration date or anything. When you get home, you might find that you bought a Ford sedan unexpectedly.
Okay.
So you want to say hi and give us your first name?
Michelle.
Michelle, great. And you're from where?
Washington State.
Someplace in Washington.
Yeah. By Portland, Oregon.
Now, if you want to, we could use this as advertising. Could say that you're in real estate. You want to? You could.
Yeah, I don't want to get into all
no,
that.
Okay. We have some people who, advertise their business and say, "Hey, I'm on the internet. Call me for your towing services in Las Vegas." So.
Yeah.
All right. So you're a realtor.
Uh-huh.
Somewhere in Washington.
And Oregon. I'm Washington and Oregon.
Okay, but we're not going to say any more.
Okay.
And you are a special MGB patient.
Yeah.
Because before you had the MGB, you had...
Am I supposed to be looking at you or the camera?
The camera. if you look at me, though, it's not a tragedy.
Okay.
You know, we're not going to say cut.
Okay.
And you as the star and I as the director will get together and say, I need more emotion.
I had a lap band removed.
You had a lap band removed. Okay, so do you want to tell us a quick story about your lap band?
Well, I had it for almost 4 years, 3.5 years. And I had, for the first year, everything was pretty, first couple years it was okay.
Right.
I just never really lost very much weight. The most I ever lost was 30 pounds.
So you got a lap band 3.5 years ago.
Mm-hmm.
The surgery went great.
Yeah, the surgery was okay. There was no complications or anything.
Surgery went smoothly, and you're kind of cooking along, doing pretty good.
Yeah, it took a long time even to lose 10 pounds, but because they could never get the fills right, and I was 3.5 hours away from where I lived, so I had to keep driving to go get fills like every week. So it never was totally...
So for how many weeks were you driving 3.5 hours over?
One way, 3.5 hours one way, 3.5 back.
Right, and then you have to be there for a couple hours, right?
No, it's pretty quick. They just get you in. You're there for a half hour. Yeah.
Okay.
You're half hour, and they do your fill, and then they tell you, they don't want to fill you too much because then you might be back. And I just wanted them to give me more fill, but I had to keep going back every week. And that went on for a couple months, probably.
So maybe 8 times you drove back and forth?
Yeah.
Ouch. Were you happy?
No, I was frustrated.
Yeah.
I think if I remember right, I'd lost maybe 10 pounds doing that.
So you probably just driving that much time, you'd lose that much weight. No.
Yeah. So then I ended up. Eventually, I lost about 30 pounds and kind of stayed stable.
Right.
But then, just out of the blue, I started getting really bad reflux. Have no idea.
And we now know a secret. We know why. Since your surgery, right?
Well, yeah.
But you didn't know at the time.
No, but see, that wasn't there, though.
Right, I know.
Because they do these little floral, where they see your stomach and see the liquid going down, and everything was okay.
But they had
taken fluid out.
Right. So you're having troubles, you're back and forth.
Yeah.
And then all of a sudden, trouble. Is that true? Is that what you're saying?
Well, yeah, no. There was trouble before this time, where then they almost took all the fluid out. So then I had to keep going back and forth again.
For years?
No, this is for like 6 months, 8 months,
okay.
Yeah. Because they took all the fluid out and they put me on this 6-week thing,
right,
where I had to keep coming in and gradually put it in,
right,
because I was causing the reflux and causing the heartburn.
Right. And
so then they put me on Prilosec, which I hadn't been on,
right,
because I hadn't needed it.
Right.
There was never any problems. So then one of the last times I was there, the nurse couldn't figure out why I was gradually gaining weight. And everything looked fine, but I'm still gradually gaining 1 and 2 pounds. And so she showed the doctor the little x-ray they take and just said maybe she needs a reposition, like more up on the stomach or something.
Like maybe the band had slipped.
Well, yeah, you said, no, it hadn't slipped yet. because the bubble wasn't there. Because I've seen,
bubble.
you know what you're talking about with the bubble. I've seen but it hadn't slipped yet.
Maybe.
Yeah, from that X-ray,
Okay.
or from that whatever picture they take. Anyway, so then the doctor said it looked as perfect as it could. And so that's when I walked out and just thought, I don't know what I'm going to do.
It may be perfect, but you're not losing weight and you're hungry.
I'm gaining.
You're gaining, right? That wasn't.
And I'm still gaining, and I'm still having reflux.
having reflux.
I'm gaining, and I'm having reflux.
Otherwise, the band's been a big success. Did they ask you to be a spokesmodel for the band?
No. And then, and she did. I do remember this one nurse said, maybe this isn't for you. I was shocked. Because I was like thinking, okay, what's my other option?
Right.
If you're telling me that,
right.
What is my option?
What
I didn't ask her. No. I let
What about the
thinking,
rude nurse you told me about? The one who said it was your fault?
Yeah, that was like in the first year.
Right.
Because I wasn't losing.
Well, that was your fault. This band is great.
Yeah.
And you're bad.
And I wanted to cry when I'd go in there.
Yeah.
Because you go through all that, and then they sit there and act like I've only lost 10 pounds. And
what's wrong with you?
Yeah.
Yeah, they don't say what's wrong with the band.
No, she totally was all over me, and I almost never went back.
She was pretty rough.
I was just like this. Can't.
What was that movie, Nurse Ratched? She was a rough nurse.
Yeah.
Okay.
Yeah, I just made sure when I called again for appointments, I never got her.
Yeah. But see, that girl's getting just what she wanted, fewer patients. So she has less work to do.
Yeah. Well, she's not there anymore, so I don't know what happened to her.
Okay. So finally, you're having all this trouble. Then how did you end up with the MGB? What happened next?
Well, to tell you the truth, I have a friend who I went back to Washington, D.C. with to help redo her son's home. She's had I think she's had the RNY.
Mm-hmm, mm-hmm.
She's never admitted to me. She's had it. And
so
she's like probably had it for 8 or 9 years. And I spent the whole week with her, and I came home depressed because she's thin, she can eat whatever to a point, she doesn't eat a lot.
Right.
But I spent the whole week with her, and I'm like thinking, I cannot handle this anymore. And I kept thinking, what are my options? And this was in October, right at Halloween time. And so I came home, and I started making phone calls about places around where I live, hospitals. I looked up in the yellow pages, and most of the places were saying, if you have a lap band and you've failed, we can't do anything for you. They basically were like, we're not touching you. This is what they were saying over the phone. That they didn't know the whole story, but that's what they were saying over the phone.
Right.
And so then I went on the internet and I just started searching stuff, and I couldn't find anything. So I gave up for about a month. And then I just one day thought, what can I punch in that will show me? There's got to be some things. So that's when I put in, I don't know why I'd never put in failed lap band.
Failed lap band.
I hadn't put that in.
Whose smiling face came up?
Well, this came, something, I don't remember what came up. It was something to do with...
For the purposes of the video, you say, Dr. Rutledge.
Dr. Rutledge. Mini MGB came up, which I had no idea what it was.
Right.
But then my friend that I'd gone to Washington to see, her husband had the RYN a couple years ago. So she kept saying, you just need to go to our doctor in Boise. And I said, well, I said, from what I'm reading, I don't think that's an option for me anyway because of the lap band. It's too risky. Oh, and the first thing that came up, there was a doctor here in Henderson I called, actually, because that came up too, and they said that it was too risky to take out the lap band.
Right.
But I think they do RYN or something too.
Right.
So I don't even know if that was an option. And then your stuff came up, and I just started. I was excited to find it because I had been for months trying to figure out what my options were. Because I knew I needed to get the lap band out. And I didn't want to just take it out and be left with nothing.
Our experience has been if you just take the band out, because we get people ask for that, they've had it, and that they basically gain all your weight back plus more. It's like being on a long diet. So you end up actually heavier.
I'm sure.
Yeah.
So I had, at surgery date here, I had lost 15 pounds from the lap band in 3.5 years.
Ouch.
Because I'd lost and
how many trips total you think you made back?
I have no idea. And then they start charging $150.
Right.
each fill.
So you're not going to be a big proponent of the lap band, is that right?
No.
You're not going to talk your friends into it?
No.
No. Okay.
No.
All right, so then you get here, and you had surgery last Wednesday.
Yeah.
You want to tell us about how that went?
It went fine. I have a hard time with anesthesia, so I had a lot of dry heaving.
Get some nausea afterwards.
Yeah.
But there was something really exciting, although somewhat negative, that we found. An explanation for your problem.
Well,
you had a gigantic slipped band with a huge bubble of stomach above it. So, I don't have my magic marker, but your stomach comes down like this, and there's supposed to be a band right here, which there was, but there was a huge bubble of stomach like this. So when you would eat, it would go over here, and then at night you would, can you see it? You had a huge bubble of stomach over there. A big, so the band had slipped. And that's why you're having trouble. Now the bands almost all slip, and they all have one trouble or another. But the reason you were aspirating and having trouble, you had a slipped band. So.
Well, and the surgery took longer than normal because of that.
Well,
so
we took out your port, which took about 15 minutes.
Yeah.
We took out the band, and we had the big bubble of stomach there. And so you had more nausea and vomiting afterwards because we had to cut through all the swollen, inflamed area around the band. So that's why you had a little bit more nausea and vomiting than our average patient.
Yeah.
Because you had a slipped band with a lot of swelling, edema, and inflammation. That's why the other doctors were shying away from doing your surgery. So you had a little bit of extra nausea and vomiting. How long did you stay in the hospital?
Just the one night.
So you had.
But I checked out later the next day.
Right. Right. So that even though you had some nausea and vomiting, from we think in part because you had that kind of complication of the lap band, you're still in the hospital just a little over 24 hours.
Yeah.
That's still pretty good.
Yeah.
Yeah. And how's your week been?
It's been good. I was kind of struggling because I didn't have a lot of energy, and I kept trying to figure out how do you survive on chicken broth and Gatorade and yogurt. And so I was trying to just figure out, am I missing something because I'm not having a lot of energy with chicken broth, those three things. Because I kept thinking, am I supposed to be drinking a protein shake? But I'm not.
Right. So let's answer that, because that's a really good question. So I'm going to restate your question, see if I'm saying this right. I'm weak and tired, and all I'm getting is this wacky Dr. Rutledge's Gatorade and soup. How am I supposed to heal? I'm really tired. And the answer is you don't need any protein. You don't need any extra fat or calories. As we say to our patients here, look down. You know, you've got plenty of extra calories. The only thing that causes tiredness post-op is dehydration from inadequate salt water. So if you want your energy back, Gatorade will do it. You're just not drinking enough. And you can add salt. You went up in weight a few minutes ago?
Yeah.
And what's your weight?
I'm down 5 pounds.
So it's been 6 days, and you're down 5 pounds. And how many months of the lap band did you have until you lost 5 pounds?
I don't remember. Probably at least a month.
Right. So we can see the MGB is working. It's pretty powerful, and it causes a massive loss of water in your urine. So 5 pounds, or almost a pound a day, and you know you're not that heavy to start off with. That's a lot of weight loss. 5 pounds is 20% of 100 pounds, so you've lost 15% of your body weight in 5 days. So the reason you're tired is lack of salt.
So you're supposed to eat more chicken broth, and right?
Well, if you get tired of chicken broth, it's anything that's salty should help. But Gatorade's a good choice.
Yeah. But if that's too sweet, that's why I was going to the chicken broth. You know what I mean?
Broth
the Gatorade.
And it doesn't have to be chicken broth. It can be regular soups of any kind, because personally, I'm not crazy about chicken broth as a choice.
Well, I mean chicken noodle soup is what I meant, without all the stuff in it.
Yeah.
That's what I was eating.
Or chicken and rice, or chicken and stars, or tomato soup, or all kinds of things like that. Anything at all.
And I hadn't tried the tomato soup, and I need to do the V8, which I have not done.
Yeah, those things are good. And you can actually salt those with a little extra salt, too.
Okay.
But what we see is that the MGB is very powerful, and what it does is it causes a massive loss of water, and it lowers people's blood pressure and things like that. And if you don't take in enough salt, you're going to be tired.
Well, yeah, because there was one morning I woke up really dizzy and stuff, so I grabbed Gatorade immediately.
And did it make a difference when you drank it?
Yeah. I mean, I started drinking it as soon as I could.
And if you look there's a video on your iPod that you're going to get, and there's a video on the website where we talk about this. The Gatorade is like another therapy that we're real familiar with called oral rehydration solution they use to treat cholera. So in other words, your situation is you're dehydrated from losing this water. And we want to replace that. Now, we could put you back in the hospital and start an IV. But another solution is just to give you salt water to drink. And the right concentration of sugar and sodium and potassium is in Gatorade. So just take some more. And if it's too sweet, a lot of people will cut it in half because the sweetness. You
mean they'll take it and add water?
Yeah, a lot of times it's good over ice. So
yeah, that's the only way I can drink it.
Exactly. And you can salt it a little bit if you want and things like that. That's going to gradually get better, but right now that's showing the power of the surgery happening immediately.
So how long, this is a good question for everybody,
yeah.
How long do we have to stay on that? 14 days, right?
The Gatorade is entirely up to you, and you'll know how long you need it by standing up. So in other words, sit down like I'm sitting for a few minutes, stand up. If you stand up and you say, hey, let's go to shopping, you've got enough salt water, you don't have to have any more Gatorade. If you stand up and you go, holy mackerel, weak and tired, you don't have enough Gatorade. You don't have enough salt and you need more. So it's real easy to tell. So you don't ever have to drink Gatorade now if you're feeling great. If you're kind of weak, a little bit tired and washed out, that's telling you you need to drink some more Gatorade, or it doesn't have to be Gatorade. Tomato soup, chicken noodle soup, just a saltine cracker with some water is about the same thing.
Oh, really?
Yeah.
Okay.
Now, don't take the saltine cracker dry with lamb.
But usually it's a week or two.
Amen on that one, John?
Usually it's a week or two, though, probably.
It really varies person to person. Okay? Your surgery is designed to not be as powerful as somebody who has a 400-pound weight to start with. We gave you a junior version of the surgery, which we hope is just right for you. So you should have a more rapid recovery than somebody who has a more powerful, a longer bypass. So it's really individual.
Yeah, so do you want to tell them about the bypass?
Yeah.
Or how many, or what you gave me?
Yeah.
Because I think you said 4.5, if I remember right.
Yeah.
Is that right?
Yeah.
Which I wanted a 5 really bad.
Yeah.
So he didn't give me that 5.
Nope. But remember, if I give somebody, remember 5 feet in a little person, that's a lot. Remember, my average bypass for many years was 6 feet, and that got 140-pound weight loss on average.
Oh.
So how much do you weigh?
I weighed 200 the day of.
So minus 140, that would leave you at what weight?
Minus what?
If you lost
60 pounds, yeah.
I don't think you want to be 60 pounds.
No.
Right. So beware of asking for too much. And you were in clinic last week. We had some people who were too thin, right?
Mm-hmm.
Yeah, so you don't want to be too thin.
Well, and the other question, you said with lap band patients, sometimes you have to give a little more.
You always have to give more. So if you just weighed what you are now, I wouldn't have given you 4 feet without the band. The band has kept your weight a little bit down from where it was. Probably over the past 4 years, you would be a little bit higher now. So we give band patients about another foot or 2.
Oh, so you would have only given me 3 or 3.5?
At 2, yeah.
Uh-huh.
Now you had a question about the Pepto-Bismol. You want to talk about that?
Yeah, I haven't been taking it.
No, it doesn't mean anything.
Okay. I've been taking Tums, so I've been mixed up. I've been taking Tums and not Pepto-Bismol.
Okay, let's do the big picture. The medicines after the MGB, we could care less. So patients are having surgery this week. For your information about the medicines this week, we don't care. Okay, now if you have a kidney transplant and they give you medicines, we really care. If you have a heart attack and you're taking blood thinners, we really care. But the medicines you take after the MGB, let's talk about them. If you do or do not take Tums, doesn't make too much difference. If you do or you do not take Pepto-Bismol, not life or death. If you do or do not take Prilosec, not a big difference. Let's think about what those medicines are doing and why we have you take them. They're antacids. Why are we giving you antacids? Because we cut through the stomach. We cut through the stomach and stitched it, and we want it to heal. Yet, you're putting chicken noodle soup on it. You're putting acid from the gut into it and enzymes. So we say, look, it's trying to heal. Turn down the acid a little bit. Relax. But if you skip those medicines, no big deal. None of the medicines after surgery are critical. That's great because the surgery is pretty smooth and pretty small and pretty easy. So don't worry about any of the post-op medicines. Now, for the rest of your life, taking a vitamin, taking some Tums, those things are important for the rest of your life. Taking some creatine, we think is important, but not for now. If you were wound up tight and wanted to take fiber today, I want to take Citrasil, that's fine. But if you didn't, that's also fine. For the next 40 years of your life, some extra fiber probably will help. But does it make any difference this week? No. So nothing to worry about. These medicines that you take post-op are icing on the cake. The most important thing is your surgery went perfectly and you're doing great.
Okay.
Good. Other questions?
I don't think so.
No?
Can I be just a little bit nosy?
Mm-hmm.
How much did they charge you for the lap band? The original
I think it was 16, if I remember right.
16,000,
Mm-hmm.
and that's the service they gave you.
Well, they give you 1 year of service.
Oh, well.
I mean, 1 year of going in whenever you need to for fill or run bills or yeah, that kind of thing. And it's a you know, I think there's three or four. They go in with 3 incisions, I think, but you're in and out like within a few hours. Because I remember my husband having to pull over at the side of the road because I had to throw up because of anesthesia. I'm not good with anesthesia, period. And I'm throwing up that whole day after that, too.
And I guess the next question would be to you, Dr. Rutledge. Her doctors couldn't see that big bubble?
Well, it wasn't there the last time I was there because I saw so it happened since the last, and I think the last time I was there might have been, if I went with it must have been like in November.
Are the incision sizes of a lap band the same as?
They're pretty much the same.
Pretty simple.
Yeah, because I think they use the same type of little laparoscopic stuff.
She says it wasn't there, and so I don't want to disagree with her.
Well, I mean, I didn't see it in the little X-ray thing. You know what I'm saying? It did, because I've seen myself where it's almost been a slip band, where it has been swollen like that, and that's when they've taken stuff out. So I know kind of what he's talking about because I've seen it from previous appointments, and that's when they almost drained all my stuff out because it was almost a slip band.
Well, see, what I would say is that had been going up and down throughout.
Possibly.
And so when they took that picture and you said it wasn't there, I would say it just wasn't visible, but it was there.
Yeah, it might not have been there that day.
Yeah. So when I saw it, we pulled out this, we're kind of going, you know how we make that new stomach? And we come up there and there's this band, and then we've taken that out, there's some scar tissue, and we go up to above it, and we pull out this big Mickey Mouse ear just standing there, you know, and it goes out and with a narrow thing right to the area above the band. So there's no question to me that was there. And that doesn't happen over a couple of weeks or even a couple of months. Well, maybe 6 months, but that's been there for a while. And it was big. And it's dangerous because what happens, she starts to eat dinner and it won't go through the band. And it kind of puddles over there. And then she lays down at night and it comes out, goes down the wrong pipe. Because when she was here to see us last week, she said, I had a little hoarseness, I can't talk. And I bet that the night before she had aspirated some gunk into her lungs. That's why you're hoarse. Because you had some in the back of your throat.
Well, and I was always worried about, because no one ever one time because I had such bad reflux for a while, I kept worrying about those, whatever it does to your all the acid, because I kept thinking, am I going to start getting all these problems, and do they need to stick a tube down there and check
stomach cancer and
all that. I started freaking out about all that,
right?
Because I was having that acid reflux so bad for a little while.
All right, well, you've done a great job. Can I ask you a couple of things? Was the hospital nice? Were the nurses nice to you and everything?
Yeah, there's only...
There was a mean nurse?
Well, at the end, my husband said, you make sure you tell them this. Because, they're supposed to take your bandages off and stuff, and she didn't do any of that. And so our discharge nurse, because I got home and had a whole, where the port came out, my whole gauze was total blood. And
we talked to you about that.
But she didn't even check it.
Oh. Okay.
Like she didn't check it, and my husband was the one having to nurse it, and she didn't she didn't take the pad off my arm or tell me to take it off. Right. So most of my pain was in my left arm for days.
But you know why that was?
No, why?
That's from the surgery. It's called referred pain.
You mean where I couldn't even lift my arm up?
Yeah. Because see, when we dug all this out up here, this is all inflamed and scarred. So you hurt your left arm not because of that pad.
Oh, it wasn't from that pad?
No,
okay.
That's because of my surgery.
Oh.
And you remember, you had a band in.
Yeah.
Now, do you have left arm pain?
She didn't have any of it.
Right, because she didn't have this dig out an inflamed band that been in. You had a splinter underneath your skin for 4 years. So this is all scarred, but it's not the nurse had taken off the patch.
Well, and I thought it was her not telling me to take the patch off.
No.
Because I'm finding this patch there, and I'm like, oh my gosh, is this why my arm is hurting so bad?
I saw that in your email. No, that's not.
And then I had a sharp pain in my left side.
That's the surgery.
And I was paranoid that I might have a leak or something because this pain was so sharp.
Right.
And it kept happening.
That's because
you
had surgery.
Well, and in my mind, I'm like, oh my gosh, do I have a leak? Do I have a leak? Because I had this sharp.
Yeah.
But I didn't know. I don't know.
Sure.
So, but it wasn't like major.
Right.
It was just the sharp pain when I was walking So, the hospital was great. It was just that last nurse didn't.
And leaving the pad on caused that pain in your shoulder.
Yeah, I'm leaving the pad on. Well, she didn't tell me to take it off, and I'm like, how long am I supposed to keep this pad on? Or this patch, I should say, patch.
Patch, right.
And there was a patch behind my ear.
But you're looking at the guy who caused that pain.
Okay.
I am him. Actually, it's not me. It was the guy who put that band in there.
Oh, because normal people don't get that. I mean, normally people don't get that.
I'm fibbing. That's not true. You can get pain. You can definitely get pain there. But you have more pain because there's a lot more work to dig your band out.
Okay.
So there's a lot of scarring and a lot more swollen, inflamed tissue.
Because yesterday's really the first day I didn't have the arm pain.
Right.
And I kept thinking, I couldn't figure out why.
It's because you had the band.
Okay.
Yeah. Good. Other questions?
No.
Do you think you've done a good enough job to earn your iPod?
I think so.
Okay. Can we applause that you got an iPod? All right.
Now I have to figure out how to use it because I don't know.